Dr. Wadai, you've been a surgeon for how long?
And I've been practicing for nearly 30 years.
And over the course of that 30 years, can you just tell me a little bit about what you have seen, how you've seen treatments progress, how you've seen survivorship rates progress?
Well, and let me be really frank about this. Frankly, speaking, the mortality from breast cancer has not changed significantly in the last 50 years. And this is a very shameful thing to discuss, but I want to bring it out in you because people have to know. So a woman who's diagnosed in the 1950s with breast cancer compared to a woman who's diagnosed in 2011 with breast cancer, both those ladies have the same chance of dying from breast cancer. Things have not changed. The mortality rate has not changed. What has changed is the length of survival. So women are living a much longer period after diagnosis and treatment, and also their quality of life has improved somewhat. But the overall mortality has dropped very little in the last 50 years, and we ought to be very ashamed of ourselves because of that. The medical community I'm talking about. Very slow progress.
Yes. Now, with all of the funding that has gone into research, can you give me a little bit of clarification about research? Is research for a cure, or is research for treatment, Dr. Wadai?
That's an excellent question, and ideally it's for the cure. But unfortunately, at this point, we're limited in our capabilities. So research really still is directed at treatment, and the ultimate treatment of that, the ultimate goal of that treatment is obviously to cure the patient. Breast cancer has become kind of what we call now a chronic condition, because so many women are living, and this is a wonderful thing, for so many years after their treatment. So it's really not an acute illness anymore. Initially, when the initial diagnosis obviously is treated as an acute illness, but really it then turns into a chronic condition because the ladies are living a very, very long time, which is great news.
Exactly. And what is the reoccurrence rate? Now, I know that is specific to, the initial diagnosis, maybe how old the person is, other maybe genetic factors, etc. But overall, do most women who are diagnosed, do they experience a reoccurrence at some point?
Well, this is a very interesting question as well. Generally speaking, and these are very, very rough numbers, women who have lumpectomies have a 10 to 12% chance of recurrence. A woman who has a mastectomy has about a 5 to 6% chance of recurrence. But there's many, many variables that go into this. So one is age, of course. The younger a woman is diagnosed, the more likely she'll have a recurrence because she's going to live a lot longer. So, a 35-year-old woman who's diagnosed has a much higher chance of recurrence than a 70-year-old who's going to possibly die of a heart attack or a stroke before they get a recurrence. But there is a term that's used by some in the medical community called tumor dormancy. And what this means is that even though the original lesion, the original cancer has been removed and treated with chemotherapy and perhaps radiation and hormonal blockade, the tumor seems to go to sleep in the body. And we think we've eradicated it, but there are recurrences that occur 25 years after the original diagnosis, and this is referred to as tumor dormancy. And this particular situation is seen more commonly in breast cancer than any other cancer that we're aware of.